yes, currently I'm coordinating the Wandsworth under 5 CAMHS. My background is I was a social worker and then a play therapist. So I used to work with young children individually, but I found that they couldn't make, especially young children, couldn't make the kind of changes that we would hope for on their own. So I then trained in systemic practice. I've run a lot of parenting groups in my time, and I've done the CYPIF Parenting Therapy Supervisor course, and I'm a VIP SD intervener. I'll say a little bit more about VIP in the presentation. So Wandsworth Under 5 CAMHS, we're an emotional wellbeing service for young children under 5 presenting with emotional, behavioural or psychological problems.
Jackie, sorry, your presentation isn't sharing.
Let me see. I think I'll go out of slideshow and share it in a different way. Bear with me. Can you see it now?
Yeah, I think in the past this way's worked better. And I don't know if you can just make it larger or something from using the plus and minus at the bottom of the screen.
Yeah. Yeah. A bit too large. Is that okay?
As long as you can move it up and down, I think it's probably fine. Yeah, perfect.
Okay.
Thank you.
So in Wandsworth, we're very lucky to have funding both from the Clinical Commissioning Group and the local authority. I noticed when we were speaking, we didn't have people from Merton in the room. Am I correct? But we do have people from Kingston and Sutton. So I'm speaking today from my position as currently the Wandsworth team coordinator, but I guess, you know, this presentation, I'm kind of thinking about what's our trust-wide offer for under 5s. So I will, as I go on, kind of move into thinking about Merton and ask maybe those who are present who might know more about Kingston or Sutton or Richmond to chip in. So to my knowledge, the Wandsworth under 5 CAMHS is kind of the best funded under 5 CAMHS in the trust. We have both CCG and LA commissioned money. Merton have just the CCG element of the money, so it's a much smaller service. Merton have just one staff member, and I believe a service is soon to be established in Sutton, so we might be able to hear a little bit more of that later from people who are present. I'm not sure what the offer is in Kingston and Richmond. So just speaking from the Wandsworth perspective, we're based in Wandsworth Children's Centres. We work flexibly in the community to really with the idea of improving access, reducing the stigma of kind of mental health services, so much more seeing mental health, mental well-being as a kind of universal offer. We're doing many home visits, and we're also offering sessions in children's centres, schools and nurseries. So it is quite a small team, despite having the extra local authority money. We're 6 full and part-time NHS employees, covering the equivalent of 3.6 full-time posts. So we're really 3.5 staff. My role is 3 days a week as the team coordinator. And then we have 4 primary mental health workers who make up the equivalent of 2.8 full-time staff. And the primary mental health workers have core mental health training in child psychotherapy, art psychotherapy, clinical psychology. At the moment, we don't have a family therapist in our team. Although 4 of the team members have undertaken systemic training. May I just ask people to turn the microphones off because I'm getting a little bit of feedback. Sorry, it's distracting me. Thank you. Yeah, so 4 of our staff members have completed systemic training to foundation or intermediate level, and I'm going into my qualifying year next year as a family therapist. We have administrative support just 1 or 2 days a week. So this is the staff members as it stands. We've got two very long-standing staff members, Catherine and Amanda. Catherine's a child psychotherapist and Amanda's an art psychotherapist. Catherine's full-time and Amanda's working 3 days. And then we have two clinical psychologists who just joined us last autumn, Steph and Rachel. And Sue is our administrator who helps us with letters and gathering data. And we always as well have an art psychotherapy trainee. This year it's planned for us to have some psychology MSc students from UCL as well. So the referral criteria, we accept referrals for children up to 4 years, 6 months. So the idea is that we will have time to deliver assessment and intervention by the time the children are 5. As it stands, our SLA states up to 4 years, 6 months rather than up to 5. And we accept referrals for children presenting with a wide range of emotional well-being issues. So our thresholds really are quite low. It's a wide range of issues. I'll come to that in a moment. In Wandsworth, we can accept referrals for children who either live in the borough or have a Wandsworth GP. And that reflects the fact that we have the local authority money. In Merton, the referrals are accepted for children who have a Merton GP. So living in the borough alone is not sufficient for referral into the Merton under 5 CAMHS. There are some kind of context differences that are worth mentioning. So Merton Children's Centres have a big children parenting programme offer. So any parent living in Merton who doesn't have a Merton GP can attend the children's centre programmes, and we can offer consultation to the children's centres for families they're working with. So we do reach Merton residents who don't have a Merton GP in that way. So the referral concerns we tend to see are around parent-child relationship difficulties, attachment difficulties, separation anxiety in young children. We receive referrals for developmental difficulties, and that would include children with social communication difficulties, speech and language delay. So our commissioner from the local authority is very keen to ensure that children who have social communication difficulties without additional emotional behavioural problems would be referred to Wandsworth Autism Advisory Service for a universal or targeted programme in the first instance, but we will see children who have social communication difficulties or a diagnosis of autism if they're also presenting with emotional behavioural problems and they're under 5. We see children who have toileting, feeding and sleeping difficulties. Usually for those referrals, we would ask that they have had some kind of a universal input around those difficulties before they would come to us as a Tier 2 CAMHS. We see children who have emotional difficulties, including anxiety. So we've had several referrals this year for children who have a kind of social or generalized anxiety picture. And we've had one referral for a young child who's refusing to go to school at reception. But then again, we also see a lot of referrals for anxiety that's more kind of age appropriate in terms of separation. We have referrals for children who are identified as having behaviour problems by parents or professionals, children who've experienced trauma, and children whose emotional needs may be impacted by parental mental health difficulties. So we're a CAMHS. We don't treat parental mental health problems, but many of the parents we work with do have mental health problems. So the exclusion criteria for the service in Wandsworth is active current domestic violence. So where there are any safeguarding issues, they need to be managed before they come to our team. And then we will work where there are safeguarding issues, but active current domestic violence, that we need the child to be safeguarded first. Another exclusion criteria is child protection case not allocated in social care and families in court proceedings. So I will leave time for questions at the end. I know I'm going fast. I'll finish by 10 and leave time for questions. So just to give a kind of picture of the work we've done over the last year. So our service level agreement target is to complete therapeutic interventions for 150 children per year. So in the last financial year, 2020 to 2021, we received 143 referrals, which was just 7% down on the number for the previous year, which we think may be to do with the impact generally of the pandemic on services. Some services were closed, some children, parents chose not to send them to their nursery setting. It was more difficult generally for services to work as normal and for parents to get out and about. We saw a big difference last year was that we saw fewer referrals for children under 2. So the majority of referrals we had in the last financial year were for children aged 3 and 4. And that, brings up quite a lot of worry in terms of, those very young children and the impact of the pandemic. The majority of our referrals are for children living in the 0 to 10% area of deprivation, and that has been the same year on year. That is so our local authority commissioners really want us to target those children who are living in deprived parts of the borough. So this graph just shows you the gender. The majority of our referrals are for boys, 88, and 55 for girls. So last year, so that this light blue area, 37%, this is for 4 to 5-year-olds. The dark blue area isn't on the chart because we had no referrals for children under 1. So the majority of children were 4 to 5, so age 4, and then age 3, then age 2, then age 1, and no children under 1 were referred. So the area of deprivation, we can see that this 48 is of the children lived, is that 48%? I'm sorry, I think it's percent, lived in the 0 to 10% area of deprivation. And we can see that all of the 0 to 40 area of deprivation were the highest number of referrals we received. Most of our referrals came from health visitors and local GPs last year, followed by speech and language therapy, Thrive and children's centre services, education settings, and paediatricians. And we have a graph that just shows this. So the most common presenting problem we had at referral was around behavioural difficulties, followed by developmental difficulties, including social communication difficulties and hyperactivity. So this graph just shows you. So also referrals for attachment difficulties, children who are presenting with anxiety, complex physical, emotional, and or psychological difficulties. These were children who had a kind of mixed picture. It says here that there were just 3% who were affected by parental mental health, but I think the figure is probably higher, and we're maybe not capturing that. And other, I think, was around feeding, toileting. One child, I think we had a referral for a child who had a tic disorder. We didn't do that work, we referred on. So for about 20 of the referrals last year, we signposted to more specialist services or more appropriate services. So for children over 4 years, 6 months, we would have signposted back to generic CAMHS. I think we signposted to WAS, to a specialist DV service, to CAFCAS, to the complex feeding team. So what interventions do we offer? So bearing in mind that most of our referrals came for boys with behavioural problems, the nice guidance for behaviour problems and ADHD is parenting therapy based on social learning theory, such as Incredible Years, Triple P, PIPT, personalised individualised parenting therapy. So that was formerly known as parent-child game. I don't know how much people know about these things, so I don't know if I'm going too fast, but I can come back later in the presentation. So NICE recommends that group-based parenting programs be offered based on social learning theory, and that those programs should have a combination of discussing parenting strategies, watching parents demonstrate the strategies, and then practicing the strategies with your own child in between sessions. For those parents who can't attend groups, maybe because of mobility issues or for some other reason they can't access the group, perhaps because of English not being their first language or learning difficulties, mental health problems, you know, whatever reason makes it difficult for them to access a group-based program, NICE recommend that individualized parenting therapy be offered. And so PIPT is a form of parenting therapy where you live coach the parent with their child present. So at the Maudsley Hospital where it was developed, this is done through a one-way mirror. The parent has an earpiece, and the therapist speaks to the parent through the mirror to coach them, really. So, for example, if the session was on non-directive play, the therapist might coach the parent in descriptive commenting, which would be describing what the child is doing, staying kind of one step behind the child, following the child's play, avoiding too many questions. They might notice moments when the parent could praise their child. And so the teaching is done live with parent and child. So NICE recommend for attachment difficulties or for preschool children with or at risk of attachment difficulties, video feedback programs, which Jill presented on yesterday. And so that's recommended for under 5s. I think it's also recommended for children who have autism, and examples of video feedback programs are VIG, video interaction guidance, or VIP, video intervention feedback for positive parenting. And I give some references at the end of the presentation so you can find more information about those interventions. NICE also recommend parent-child psychotherapy based on a particular model, Chichen and Toth, for preschool children who have been or at risk of being maltreated. So that's the NICE indicated treatments, but we do offer, in addition to the NICE treatments, so I should say that in CYP IAPT's under 5's programme, what the trainees are taught are parenting therapy interventions, group-based and individualised, and also video feedback interventions. Some CYP IAPT programmes use VIG, so the southwest of England, I believe, use VIG from Exeter University, and some CYP IAPT under 5 programmes use VIP, so the London consortium is using VIP. So those are the two main interventions, parenting and video guidance, that could be offered for under 5's trainees. But we offer as well other evidence-based interventions as well as comprehensive assessment. So we have Amanda, who's in our team for 10 years, who's an art psychotherapist and works with children and their parents, carers, and sometimes families to offer dyadic art psychotherapy or family art psychotherapy. It's probably important to say that all of our interventions are offered to children with their parents, carers. We don't see children individually, because in recognition of the fact that the relationship is our client. Catherine, who's another long-standing member of the team, can offer parent-child psychotherapist. She's a child psychotherapist. I'm sorry I can't speak too much on art psychotherapy and child psychotherapy because I'm not trained in those modalities. We can offer parent-led cognitive behavioural therapy for the older children in the service. Now, this is really evidence-based for slightly older children than 5, but we have seen children come to the service who are presenting with phobias or generalized anxiety and social anxiety alongside, I can think of a child who's got social anxiety alongside a diagnosis of selective mutism. And so skilling up her parents in parent-led CBT strategies has been very helpful. So, for example, we began doing some couple work, systemic couple work with that child, and then the case was transferred to a psychologist to continue the work with parent-led CBT. We can offer personalised, individualised parenting therapy, as I've described already. So I'm trained in video feedback intervention, so I'm an accredited intervener and have supervision from the Tavistock Clinic for video feedback intervention for positive parenting and sensitive discipline. There are different modules for VIP, so some are VIP family placement, VIP auti for children with autism, VIP alone without the sensitive discipline component for babies. My training is in VIP for babies, VIP SD, which incorporates the sensitive discipline element, and VIP family placements. So this will, when I move to Merton, I'll take this intervention with me. But the rest of the team are trained, they've had the initial 2-day training in VIG, and we're currently offering VIG informed therapy because at the moment the supervision is not coming from VIG UK, it's coming from in-house from our internal supervisors who aren't VIG accredited supervisors. So that's a kind of goal we have going forward. And we offer systemic family work. So I'm getting very close to the time for questions. Just 3 more minutes of me talking. We offer 2 group-based interventions. So there's a psychoanalytic parent-toddler group offered in conjunction with the Anna Freud Centre, and that's a slow open group. So parents and their toddlers come for a year to that group. It's facilitated at the moment by a clinical psychologist from our team and a child psychotherapist from the Anna Freud Centre. This year we've run with only 4 children and parents in that group because it went online during the pandemic, but we are hoping to return to face-to-face in the summertime. This year we didn't offer our Incredible Years programme, but again, because of the pandemic, it's difficult to deliver this programme online, so we did the individualised work instead. But we are resuming Incredible Years basic toddler programme, so for children aged 1 to 3, and that's for children who are presenting with common behaviour problems. So I think I didn't put a slide for this, but just to throw up in there that often we receive referrals for children who are identified by their parents or professionals as having behaviour problems, and sometimes during assessment we might formulate that as a behaviour problem and emotional problem or relationship difficulty, you know, or all of those together. And I guess there's sometimes debates about whether an under 5 service should be predominantly an attachment-based service or behaviour service. And so I suppose in my mind, I see that we want parents who are both warm and firm. So for me, it's a both and, even if I'm using parenting intervention based on social learning theory, which would be predominantly behavioural, there are opportunities during groups or in live parent-child work to think about attunement and parental sensitivity, and I believe that that is implicit in those programs. And when we do interventions that are attachment or relationship-based interventions like VIG or VIP, VIP sensitive discipline explicitly draws on Peterson's coercive cycles in families, so it draws on attachment and social learning theory. And VIG, it gives opportunities for scaffolding. Jill, you can speak more about that, but there is opportunity in the VIG intervention for the the VIG practitioner to help parents really with tips on limit setting. So my personal feeling is that we don't need to have a either or. We could have a both and perspective. And my other personal kind of bugbear really is that we don't just work with mothers and their babies. We work with children in their carers, parents' carers, and in their system. So I, often think about parental mental health difficulties and the kind of social construction of motherhood and how that sometimes doesn't add to women's problems. And so when we're contacting parents to make appointments, do we always contact women, or do we seek to engage the children's carers, fathers, and same-sex couples, single parents? Do we look who in the network supports the parent? So we also offer consultation and training to early years professionals, and we can offer reflected case discussion. This is how you make referrals to Wandsworth. You can either phone Wandsworth CAMHS at Harewood House, or you can, we have a brief referral form which I can circulate, and you can email that to the Wandsworth CAMHS referrals email address, which is there. Our SLA does actually say that we should only accept referrals via the early help assessment, the EHIT system in Wandsworth, but we do all our health visitor and GP referrals are by letter usually, and we have agreed with our commissioner that to kind of overcome barriers for a temporary trial period, we're going to accept referrals on brief referral form. So some of the references that I've just included is, so Alan Carr has done a great overview of the evidence base for family therapy and systemic interventions for child-focused problems. Peter Fonagy has a chapter in transforming infant well-being research on what makes a difference for young children. I don't know if you can see me, I can show books. This is the VIP book, the references there, and the VIG book, which Jill showed yesterday. Parent-led CBT, it is for slightly older children, but we are trying to adapt for younger children. And I think many people will be familiar with the Incredible Years. There's also a Triple P book, and there's a paper that's a bit harder to come by on PIPT, but I can share if people are interested. Thank you, that's me finished.